So Melanie is also a student at Laurentian. She is in her second year of her master's program in human kinetics. In 2023, she graduated from Western University with a Bachelor of Arts in Kinesiology and then joined CROSH. Yay, we're glad to get her. Under the co-supervision of Dr. Godwin and Dr. Goggins, she has been piloting a really interesting project looking at seat adjustment training for workers. And so she's going to talk to you about that now, and I'll let her take over. Thank you, Melanie.
Thank you for the introduction. You can see my screen with no presenter notes.
Yes, I can. It looks good.
Okay, thanks so much. Thank you everyone for being here. I'm Melanie, and my supervisors are Dr. Allison Godwin and Dr. Katie Goggins, and today I will be presenting my master's project, which is evaluating seat adjustment training for heavy equipment operators based on knowledge, behaviors, and self-efficacy. So when we look at seat adjustment training, workers who receive this training are oftentimes employed in office settings and receive full training on how to adjust all the components of their workstation. However, there's currently no training program that exists that addresses the fact that heavy equipment operators often engage in prolonged sitting in non-neutral postures for more than 8 hours a day. So these workers rarely receive specific training about how to adjust their seat suspension and height or their lumbar support. So this is a concern as they remain seated in non-neutral postures, which is in a position where their head, neck, and hips are not aligned, or if they're rotated or slouched, exposing them to muscle and joint pain, such as low back pain, headaches, and poor digestion. So another concern is that these workers are also at an increased risk of musculoskeletal disorders. So there's a lot of research finding that seated operators exposed to whole body vibration are at an increased risk of these disorders, with the neck, shoulder, lower back, wrist, hand, and knee pain possible. So if we were to start treating this like office ergonomics, where the worker gets full training on how to adjust all the components of their workstation, it could result in better postures and more effective use of seat suspension for attenuating vibration and reducing their risk of injuries and discomfort. So seat adjustment training is important to provide operators with the tool to complete ergonomic adjustments, which would help them maintain the most neutral positions possible and reduce contact stress, so any pressures on the body that could be causing discomfort. Also, seat suspension adjustments help reduce vibration exposure. So these are techniques, excuse me, these are techniques that could offer several benefits that reduce the risk of health complications associated with long-term sitting. Before we move on to the study, I just wanted to highlight an important component, which is the EDI component of this research. So first, equity considers differences among people and groups and ensures that everyone has the same opportunities. Diversity is everything that makes us who we are as individuals, so our life experiences, our race, our languages, and more. And inclusion involves providing equitable access and opportunities and resources to everyone and making sure that everyone has voice and representation. So this is relevant to the mining industry as it's becoming more and more diverse, with more women and underrepresented groups entering the field. And one of the issues is that the design of most heavy machinery and equipment still predominantly relies on male anthropometrics. So seat adjustment training can help create a more inclusive work environment by accounting for the diversity in anthropometrics and allow everyone a chance to adjust their seat properly and reduce their risk of MSDs and discomfort. So we can't make changes to every single cab design, but we can teach people how to make adjustments that are best for them as individuals. Next, so how do we know if the training works? We have to evaluate its effectiveness. So we did develop a training program, and we used one of the most recent models, which is the Learning Transfer Evaluation model. And this model ranks training evaluation methods by what previous research has found to be most effective. So this would be tier 8 in green, to those that are least effective, tier 1 in red. So the program was designed to adhere to these tiers. We used several of them across the board, from transfer and task competence to decision-making and knowledge, which we'll see in a bit. So this is what was used as the training framework and to design our seat adjustment training. So this is the whole picture of the training. There's a lot to look at, but the left column follows the seat adjustment training group, or the trainees, which is what we'll go through today. And then the middle column is just the trainers and their role. And then the third column is for the outside evaluator, who's present at the 4-month follow-up, which I will talk about a little more later. And then throughout this training program, the trainees were assessed on musculoskeletal discomfort, their seat adjustment posture knowledge, behavior, and self-efficacy before, after, and 4 months following the training program. So we'll go through these 4 steps together and look at some of the results. So first, as part of the pre-training portion, the trainees were provided with a questionnaire package to gather some information on their background and current and past discomfort levels. So a bit on the demographic information. Here are the results for their age. So we have age, the years of the participants and the number of participants, and we have age group ranging from 18 to 55 plus, so pretty wide range there. And then as for the gender, all the trainees identified the same gender and sex. So there were 28 males and 8 females who participated in the study. Next, we have the cultural diversity of the participants. So we have their cultural background for the number of participants, and this just demonstrates the diversity in the participants representing the workforce, which is important to ensure that the program meets everyone's needs. And then next, I have the weight of participants, so their weight, again, with the number of participants. And this information is important when it comes to the seat suspension adjustments and reducing exposures to vibration. So it's good that we have a wide range here as well, to see if there's any gaps in the training program and to see if everyone can complete the adjustments based on their individual differences. And then lastly, we have some information regarding their occupation. So here we have the hours and the number of participants for the average length of shift per day. So we see that it's most often 10 to 11 hours. And then we have the amount of time that they're operating the equipment. So this ranges from 5 to 10 hours. So this demonstrates that operators are spending most of their shifts seated and highlights the need to implement a program to address the lack of seat adjustment training in the mining industry. So now part of the pre-training portion, we gave the trainees a discomfort assessment using the Nordic musculoskeletal questionnaire. So this discomfort assessment allowed the trainees to report any discomfort that they felt at that moment and within the last 4 months. So on the left, we have the color-coded diagram that corresponds to the person's body area, and they can rate their discomfort using the corresponding table and this scale. So the scale ranges from 0 to 100 with some verbal prompts on the side, from nothing at all to very strong and maximal. So this was provided to the trainees as a reference. So they follow the verbal prompts and then assign a numerical value based on those prompts and then insert it into the table. So if they thought they had some strong discomfort levels, they would assign around 45, and then they put it in the table. And that's how we assess their discomfort. And this information will help us see if the training program will reduce their discomfort pre and 4 months following the training. So here we have the results for the discomfort assessment for the last 4 months. Again, the column on the left is the body area corresponding with the figure on the previous slide, and we have the severity of frequency for each section on the scale. So again, nothing at all, weak, moderate, strong, very strong, and maximal. So as we can see, the head and neck as well as the lower back have high prevalence of discomfort across the board, with numbers in the very strong and strong sections indicating high level of discomfort in these areas, as well as a few other areas as well. And then here are the results from the discomfort assessment that the trainees were currently feeling at the time of the training. So we can see again, the head and neck and as well the lower back have even higher levels, the prevalence of discomfort. Again, with the numbers in very strong and strong, reaching even 9 or a quarter of the participants having very strong levels of discomfort, which is concerning. So relating back to the figure and the scale, we can see that the highest prevalence of discomfort is in the head and neck as well as lower back, both reaching up to very strong levels of discomfort, indicating a need to implement training to attempt to reduce these levels of discomfort. So along with the discomfort assessment, the trainees were given a pre-training questionnaire that included questions assessing their knowledge, behavior, and self-efficacy related to seat adjustment. So why did we want to track knowledge, behaviors, and self-efficacy? So first, knowledge is important to identify the direct impact of the training. So any immediate improvements in the knowledge would indicate that the training content was successfully communicated. And then long-term retention, which we would see in the 4-month follow-up, would demonstrate if the application of the training is sustained in the workplace. The behaviors are important to look at, as behavior assessments allow us not only to see theoretical improvements, but actual changes in practice, indicating the training success. So sustained behavior changes demonstrate that the training has a lasting impact, leading to a safer and more effective operations. And then lastly, self-efficacy, which is in the beliefs in one's ability to execute behaviors. An increase in self-efficacy following the training would suggest that participants not only learn the material, but also feel more comfortable applying it. So this is a strong predictor of whether the knowledge and skills gained will be utilized in the workplace. So overall, incorporating these assessments allows us to evaluate the impact of the seat adjustment training and assess the knowledge and behavioral changes linked to the training. Now onto the training portion. So this consisted of a training video and a hands-on portion where the trainees were had hands-on practice adjusting the seat of a cab with the trainer. So as I said, it started with an introduction video where we played video that summarized all the steps needed to complete the seat adjustments. And along with that, the trainees would follow along with their seat adjustment guide or this brochure. So this guide outlines the 7 steps necessary to adjust their seats. So first we have the seat suspension and height. Then we have the backrest angle. 3, we have the seat pan angle. 4, lumbar support. 5, distance between operator and controls. And then finally 6, fine tune, and 7, setting the peripheral components. So the trainees practice their adjustments using this brochure, and we're able to ask the trainers questions throughout their session. So this is especially relevant if the trainees are hands-on or visual learners. And then this is the seat adjustment monitoring brochure that the trainers had. So it's more of a checklist style to see if the trainees were completing the adjustments. So as we can see on the right, they would check yes or no based on the adjustments that were made in each section. And then looking at the behaviors, for the 4-month follow-up will really show us if there's a difference in the trainees' behaviors. But in the initial training, approximately 90% of the participants were able to make most, if not all, of the adjustments. But again, the follow-up will really indicate whether the trainees can recall the adjustments on their own. And now for the post-training component, where the trainees and the trainer completed a questionnaire to reassess the trainees' knowledge and self-efficacy and also collect some feedback from them on the training. So we'll go through some of these findings now. For the knowledge component, we can see the pre and post-training knowledge scores per question at the bottom, so those 10 questions. And then the pre-training knowledge scores are in blue and the post-training knowledge scores are in orange. And we can see that the majority of the results showed an increase in seat adjustment knowledge. Specifically, question 1, 3, and 8 improved significantly. Question 1 asked the trainees about the effects of prolonged sitting in non-neutral postures. Question 3 was related to the seat height and the sight line above the steering wheel. And question 8 was related to the distance of the steering wheel from the operator's body. So we can see that comparing before and after the training, they had a better understanding of these concepts. And as this is a pilot study, we also want to see if there's any improvements or changes that need to be made as part of the training. So if we look at question 2, this was on seat suspension. So there are some errors in identifying if the seat suspension should match the operator's height, the weight, or their leg length. So this could be more clear in the training module so that more people will get it right. So overall, we can see the knowledge scores pre and post training. There was an increase in knowledge after the delivery of the training. So now moving on to self-efficacy and the results. These were based on Likert scale type questions. There were 5 of them, but we're only going to go through 2 of them. So the first one is, I know how to properly use the controls of the seats in the vehicles to adjust the lumbar support to provide even pressure along my back. So this table, comparing the results pre and post training, we can see that trainees agreed with the statement, demonstrating an improved confidence in completing this task, and none of them strongly disagreed post-training. For the second statement, I would be able to help a colleague adjust their seat suspension and height. Again, more trainees agreed post-training, which is important, as adjusting seat suspension height properly is vital to reducing the effects of vibration, as I mentioned, and ultimately reducing their discomfort and injury. So it's encouraging to see in both cases, and actually in all 5 of the self-efficacy statements, that trainees were or felt more comfortable completing these tasks post-training. And then we have some trainee feedback. So the trainees had the opportunity to provide feedback on things that we can improve on, things they like, or things they would recommend. After all, it is a pilot study, so and it's less likely that the trainees will absorb the training if it's too difficult to follow. So their feedback was very important. So this table again shows that most of the trainees agreed with the statements, such as, I believe this training helped me to understand how to and the importance of properly adjusting my seat. And important to know as well that no one disagreed or strongly disagreed with any of these statements. So it's some pretty positive feedback. Some written feedback also showed that the training was very clear and easy to understand. And some most common recommendations were to have some other seats or vehicles available to make different adjustments. So no negative feedback on the current training program, just wanting to see kind of more options. And then the trainers also find the training material useful and found that the participants were engaged. So now onto the last component, which is the 4-month follow-up. So this is where we're at now. It's currently ongoing in the process. So we have an outside observer coming in to assess the trainees on their behaviors and complete that checklist. And there is also some components from the pre-training section, including the discomfort assessment and then the knowledge, behavior, and self-efficacy assessments. And again, we will provide them with an opportunity to provide feedback on the training and its usefulness 4 months out. So this will be really important for the discomfort, as I've mentioned before, to see if there's any changes in their knowledge and behaviors. So again, it'll be completed by an outside observer, and they will go through this checklist again on the right. And this time there'll be no feedback or guidance, so we'll really see if the effects of the training were sustained. And if the tools provided by the training will be transferred to the workplace or not. So some main takeaways. First, seat adjustment training can improve operators' knowledge and self-efficacy immediately post-training, as we saw in the study. Second, seat adjustment training should be implemented into standard equipment operator training to increase awareness of the effects of prolonged sitting and knowledge related to seat suspension and height. And lastly, this training program could help operators reduce their risk of MSDs and injuries, which we'll see hopefully in the 4-month follow-up. Thank you.
Great job, Melanie. Thank you so much. We've got a question in the question Q&A here. Not all seats have those adjustments. What adjustments are the most important if you can only have a few options?
Yeah, so not all seats have these adjustments. They're kind of just recommendations and trying to get kind of a broad, because all the seats are very different. But I would think the most important ones are definitely the seat suspension and height, as this is, as I mentioned, like related to vibration and reducing those effects, and that's what causes a lot of the discomfort or injuries. And also it has to do with kind of your visibility as well. I think that would be the top one for sure. And then some
Okay,
other for comfort would be like the lumbar support, as we saw, like the lower back pain was pretty high. So that
right.
would be the next one. But it's hard to get all of them perfectly. They're just recommendations to try to make the most out of your seat.
Okay. Okay, and Kathy Lynn Shaw has two questions actually. The first one is, were the workers in only one piece of equipment or were they trained on in multiple seat adjustments?
So we only had them in the study in one piece of equipment. But that's where they were asking if they could have different pieces of equipment, because at the time, again, we only had one, but maybe it wasn't the vehicle that they were operating in their everyday
Right.
environment. So that's something that in the future, maybe customizing um, the program to specific vehicles for individual workers.
Okay, that makes sense. And her second question is, who were the trainers and what kind of training did they receive?
So the trainers, so cross researchers went to industry partners, and we trained the trainers. So they were supervisors, or were the ones who implemented um some of the onboarding training, and we taught them the steps and went through the brochure with them and had a training session or two training sessions with them. And then once they were comfortable and felt that they understood all the components, they were the ones who trained um, the trainees, so that even when us as researchers aren't there, the program can be sustained and continue to be run even without
Right.
the presence of the researchers.
That's important. Okay, I think we have time for at least one more. Aiden Robinson says, do you find that manufacturer instructions provide adequate information to users on proper seat settings for height, weight, or other user factors?
I think it's pretty general.
Mm-hmm.
I think Dr. Goggins can probably build on this because she'd know more. But part of the problem that we're trying to address is that it's pretty broad and not specific, and or not as inclusive as it probably could be, making it difficult for everyone to make it or meet their individual needs. But I'm not sure if Dr. Goggins has
Yeah,
anything.
sorry, I'll help you with this one, Melanie. Yeah, so the manufacturer instructions are pretty specific as far as they will show you like where the location of the different controls are, but they won't necessarily connect that with the purpose, and they don't connect that ever with like what the operator, why they might want to change that, or with Melanie's training here, we tried to associate it back to possible health effects of, okay, you need the lumbar support here to reduce the compression forces. You need the seat pan at a certain angle, so again, there's not compression behind your knees, so it was very relatable. Whereas with just the instruction manual, it doesn't necessarily tell you why you might need to do that. The
Right.
suspensions are not often taught. The suspension system's not often taught very well. The height adjustment control is taught more like office ergonomics, but not necessarily the suspension.
Okay, and there is a question about the age ranges of the participants. Can you remind us?
Yes, we had participants from 18 years old all the way up to, it was 55 plus. I think it might have been in their 60s or so.
Okay.
But yeah.
Okay, we're kind of out of time. There is a comment with a question. Maybe can you address that as
In the
I
chat.
introduce the next speaker? Yeah.
No worries. Thank you so much.
Um, okay, wonderful job though, Melanie. And again, interesting study. Remind me, is the information available on the CROSH website? I should know that.
I don't think it is.
Not yet.
No?
Not yet. No,
Okay,
it's
not
not
yet.
yet.
It's coming.
So
It's coming.
we're
So if
finishing
you're information interested in it, what they do, Katie?
yeah, if you're interested, we're just finishing up the pilot study. So like Melanie said, we're still in the follow-up phase, and then we're looking to design a package for workplaces as well.
Awesome. So stay tuned.
Stay tuned.